जय विघ्न विनाशका। प्रेम ईश्वर है, ईश्वर प्रेम है। प्रेम ईश्वर है, ईश्वर प्रेम है। प्रेम ईश्वर है, ईश्वर प्रेम है। ईश्वर है, ईश्वर प्रेम है। हर धड़कन में साई समा है, ईश्वर प्रेम है। हर धड़कन में साई समा है, ईश्वर प्रेम है। हर धड़कन में साई समा है, ईश्वर प्रेम है। हर धड़कन में साई समा है, ईश्वर प्रेम है। प्रेम ईश्वर है, ईश्वर प्रेम है। राम रहीम कृष्ण करी, राम रहीम कृष्ण करी। बोलो राम रहीम कृष्ण करी, बोलो राम रहीम कृष्ण करी। जोहराष्ट्रा येसु नानक, जोहराष्ट्रा येसु नानक, जोहराष्ट्रा येसु नानक, जोहराष्ट्रा येसु नानक। कोई भी नाम जपो रे मनवा, ईश्वर प्रेम है। कोई भी नाम जपो रे मनवा, ईश्वर प्रेम है। मनवा कोई भी नाम जपो रे मनवा, ईश्वर प्रेम है। मनवा कोई भी नाम जपो रे मनवा, ईश्वर प्रेम है। प्रेम ईश्वर है, ईश्वर प्रेम है।
Om Shri Sai Ram. Offering our pranams to Sadguru Shri Madhusudan Sai. Respected elders, brothers and sisters, Sai Ram and good evening. Once again, hearty Republic Day greetings to everyone. We extend a hearty welcome to our honorable guest, Dr. M.K. Ramesh, Vice Chancellor, Rajiv Gandhi University of Health Sciences. A hearty welcome to you, sir. On this very momentous occasion, we welcome you all to the launch of Rural Child Health Screening as part of the Divine Mother and Child Health Program. We will commence the proceedings with Vedic invocation by the girl students pursuing BSc Nursing and paramedical courses. They will chant verses from the Shikshavali Taittiriya Upanishad.
श्रीगुरुभ्यो नमः हरिः ॐ वेदमनुच्याचार्यो अन्तेवासिनमनुशास्ति सत्यं वद धर्मं चर स्वाध्यायान्मा प्रमदः आचार्याय प्रियं धनमारुत्य प्रजातन्तुं मा व्यवच्छेत्सीः सत्यान्न प्रमदितव्यं धर्मान्न प्रमदितव्यं कुशलान्न प्रमदितव्यं भूत्यैन प्रमदितव्यं स्वाध्याय प्रवचनाभ्यान्न प्रमदितव्यं देवपितृकार्याभ्यान्न प्रमदितव्यं मातृदेवो भव पितृदेवो भव आचार्यदेवो भव अतिथिदेवो भव यान्यनवद्यानि कर्माणि तानि सेवितव्यानि नो इतराणि यान्यस्माकं सुचरितानि तानि त्वयोपास्यानि नो इतराणि एके चास्मच्छ्रेया गुंसो ब्राह्मणाः तेषां त्वयासनेन प्रश्वसितव्यं श्रद्धया देयम् अश्रद्धया देयं श्रिया देयं ह्रिया देयं भिया देयं संविदा देयम् अथ यदि ते कर्म विचिकित्सा वा वृत्तविचिकित्सा वा स्यात् एतत्र ब्राह्मणाः सम्मर्शिनः युक्ता आयुक्ताः अलुक्षा धर्मकामा स्युः यथा ते तत्र वर्तेरन् तथा तत्र वर्तेताः अथाभ्याख्यातेषु एतत्र ब्राह्मणाः सम्मर्शिनः युक्ता आयुक्ताः अलुक्षा धर्मकामा स्युः यथा ते तेषु वर्तेरन् तथा तेषु वर्तेताः एष आदेशः एष उपदेशः एषा वेदोपनिषत् एतदनुशासनम् एवमुपासितव्यम् एवमुचैतदुपास्यम् ॐ शान्ति शान्ति शान्तिः हरिः ॐ तत्सत् श्री साईश्वरार्पणमस्तु।
The Sri Madhusudan Sai Global Humanitarian Mission focuses on addressing and providing fundamental requirements such as nutrition, education, and healthcare, especially for children who are our greatest asset as they hold the future. In doing so, we ensure every child and every citizen of their constitutional rights to justice and equality by providing access to equal opportunities. Healthy children make a healthy nation. With today's advancements, several debilitating conditions such as malnutrition, anemia, and congenital heart conditions are not only preventable, but can also be reversed through timely detection and interventions. In 2017, the Divine Mother and Child Health Program was initiated in line with the National Health Mission's Rashtriya Bal Swasthya Karyakram. The aim is to identify and address the 4 Ds, namely defects, diseases, deficiencies, and developmental delays or disabilities in children. And today, on this auspicious occasion, with renewed commitment, we continue to expand this program. Doctors and healthcare professionals from Sri Madhusudan Sai Institute of Medical Sciences and the Rajiv Gandhi University for Health Sciences will collaborate to screen over 1.5 lakh students in over 1,200 government schools across the Chikbalapur district. We invite Dr. Satish Babu, Director of Quality and Academics, Sri Madhusudan Sai Institute of Medical Sciences and Research, to brief us on the work done so far and the way forward.
Offering our collective salutations at our beloved Sadhguru, respected Chancellor, Honorable Vice Chancellor, Rajiv Gandhi University for Health Sciences, our own Vice Chancellor, Medical Director, Dr. Vasant Shetty, who is the Director for this program from Rajiv Gandhi University, dear teachers, my dear students, devotees. Divine Mother and Child Health Program is a unique program. It's an outreach, preventive primary health program which was initiated in 2017. I thought for the benefit of students, especially healthcare students, both medical students and nursing and allied sciences, to recap what happened and how this program was conceptualized. To rewind in time, in 2017, by then we had, as Dr. Sai Lakshmi said, Swami's and Sadhguru's focus is child. And for this healthcare mission from 2012 onwards was initiated in the form of pediatric cardiac services. And by 2017, we had already touched significant numbers in treating congenital heart disease. But what worried Sadhguru was the numbers, the waiting list, and almost 3 lakh children being born every year in India with congenital heart disease. When he sort of got the medical team to look into what we stumbled on or what was known as a reality which again contributed significantly to congenital heart defects is malnutrition, and especially in the rural and underprivileged families. You all know these figures. Only one point I want to make highlight is 57% of women and adolescent girls are anemic, and this is our own study done in 2017. And of course, undernutrition as a cause of mortality, which came out in 2017, again in Lancet, contributing almost 68% of deaths in under 5 children. So this pained Sadhguru a lot, and that's sort of led to Divine Mother and Child Health Program. And we know from experts that correcting malnutrition puts oneself out of poverty, because physical and academic performance obviously improve substantially. So parallelly, at the same time, in 2012 itself, with the Pediatric Cardiac Hospital, Annapurna Nutrition Program was initiated, and it was going in a big way, expanding to almost, if you see, this is 2017 figures, presence in 15 states, 2 lakh children being served, and this addressed only school-going children. So what about those anemic mothers? What about those anemic adolescent girls was the concern with Sadhguru. And that's how this intergenerational cycle of malnutrition to be broken, this vicious cycle to be broken. Only way is to start taking care of pregnant women and go one step behind, take care of adolescent girls as well. So that's how Divine Mother and Child Health Program was conceptualized to address the root cause. So it was a primary healthcare initiative, preventive healthcare initiative, and at the same time 9 countries, different teams. For example, in India there were at that point multiple state teams working. So the programs were 15 programs. So what was the motto? Motto was healthy mother begets healthy child. Simple, reducing maternal and child morbidity and mortality was the objective, and how getting associated or supporting the primary healthcare centers by augmenting antenatal, that is prenatal care, and taking care mainly malnutrition, anemia correction, and identifying high-risk pregnancies and having a pathway for the delivery of those high-risk pregnancies. So there were 2 arms, antenatal care for pregnant women and comprehensive health screening for government school children. So obviously the government school children program was supported by Rajiv Gandhi University at that point, and pregnant women, we got professional obstetric associations getting involved, and at one point we were for almost 18 months we were seeing more than 2,000 pregnant women a month. And this was September 17th, 2017, we started as a pilot in 6 PHCs. Within 15 days, by word of mouth, many doctors, many specialists got to know, and within 15 days it expanded to 21 PHCs, and on 5th of November, almost whole of district was supported or cared with this program, and that continued, and these are the numbers. Almost at the end of March 2020, when COVID lockdown was declared, we had seen almost 49,000 pregnant mothers, cared for them, served them, and more importantly, other than correcting anemia, malnutrition, what we observed was the anxiety of becoming a pregnant in rural, underserved population is a bane in a way. The joy of becoming pregnant was taken away because of the poverty. They were, in a way, many shared their anxiety with us that there is one more mouth coming shortly to be fed. That was their worry. That was their poverty extent. So the joy of pregnancy, the joy of Matrudevo Bhava are taken away because of the poverty. So we tried to instill that joy in them. We tried to allay their anxiety, and all the doctors and the volunteers who were involved were very supportive, and they did it in a very professional and compassionate way, and the impact was significant. The anemia correction happened in a big way, and it sort of revived the primary healthcare system itself, if you can put it across. So, and this is not a coincidence. You can see the figures significantly dropped when the Divine Mother and Child Health Program was in service. The district maternal mortality rate dropped by more than 50 points. And unfortunately, after the COVID, when we stopped, it has gone back. The lowest in last 4 years is 116. So it made a huge impact, and it made a big contribution to the district. And of course, with knowing this program, it got expanded to other districts as well: Gulbarga, Belgaum, Mandya, and Tumkur. So coming to school health program, as I mentioned, Rajiv Gandhi University, at that point, our beloved Dr. Ramesh, current Vice Chancellor, was an interim Vice Chancellor, and he gave this permission. He passed this resolution in the syndicate and got the permission, and the program parallelly happened for children health screening as well, and we saw almost 43,000 children and identified almost 15,000 having some eye disease, defects, deficiencies, who required specialty care, and that was also part of the program. So Vani, as you know, we didn't have an hospital or a medical college at that point, and so we had an understanding with many institutions which supported with caring and treating these children with defects. What is more heartening is the doctors, interns who came, liked the program very much, and there was instant sort of gratification for them, which made them better doctors. And in fact, it became such a popular program, there was a reverse pressure. They went back and pleaded or put pressure on the HODs that more students have to be posted, and they started posting the good experiences they had on the Facebook. And even we know a couple of doctors who went to US after their internship were asked in their interview about this program, and they wrote back saying that because of this program, probably we got the seat, because the interview was in quite detail about this program. So that was the impact, and so it benefited both the children in the rural. One girl we know who went to a lady doctor and told, I want to be like you, and come back and serve in my village. So it has both double impact, if you want to call it as. So these are the numbers, and these are the few pictures. The doctors so sincerely doing head-to-toe examination, and that sort of gave them a revision for clinical examination, and that's the reason the feedback was very appreciative and wonderful. These were the colleges which were involved. We thank all the college HODs who were part of this program. And moving on, this program also, if I may, with Swami's permission, say that gave a foundation for our hospital expansion, of our medical college concept here. And in fact, one of the main wing of our Sarala Memorial Hospital and SMS IMSR College is Mother and Child Hospital. That is the busiest service what we are giving. We are delivering almost 200 deliveries a month, and seeing almost 230 to 250 pregnant women every day in the OPD. So mother and child health part of the services is very important wing of our services now. And of course, also if you can see that 5 other mother and child hospitals came up all over the country. So the impact or the learning or the experiences had multifold effect on our mission. And Saishur, genesis of Saishur, along with Annapurna team, lot of doctors contributed to Saishur concept development and improvement of the product as a scientific backing, scientific inputs. So this program, which sort of after COVID took a back seat, is now again being revived and re-energized. And I should openly say that Dr. Ramesh took personal interest, and he has re-energized this, and he has again taken to syndicate and passed a resolution that this program has to be relaunched. And that's the reason we are here today. So the child screening part will be launched. There will be addition to interns, PGs also being included in this program this time. And it will be a 4-day program, at least 3 times a month. And we are hopeful of continuing this to next year and make it as a university and medical college program. With this, I express my heartfelt gratitude to all of them who have supported this program. And more importantly, what I want to say in this journey of our service-driven medical profession, Swami putting the divine in front of mother and child made us better doctors, and our journey to divinity has become a reality, and the process is become much easier. That's the biggest benefit for people who are doctors, professional volunteers who are part of this program, is what I observed, and it is my journey as well. Thank you, Swami.
Thank you, sir, for the detailed report. Dr. A.R. Raghupati, Director of our Medical College, will now share more details on the program and our Medical College.
Offering my pranams at the lotus feet of our Divine Master Sadguru Madhusudan Sai. Sai Ram and good evening to you all. Chancellor of our university, Murthy Anna, esteemed Vice Chancellor of Rajiv Gandhi University of Health Sciences, Dr. M.K. Ramesh, Vice Chancellor of our university, Dr. C. Kantamurthy sir, elders, brothers and sisters, and dearest students, I wish you all happy Republic Day. It is my honor and privilege to welcome you all to this significant occasion, the launch of Rural Child Health Screening Program. Divine Mother and Child Health Program is a primary healthcare initiative of our organization, which was blessed initiative of Sadguru, launched in September 2017. Divine Mother and Child Health Program has two components. One is taking care of the pregnant ladies and the delivered mothers. Other is taking care of healthcare of children below the age of 18 years. We started our work in Chikballapura district. Every third Sunday, 30 to 40 doctors, among them, most of them are obstetricians and gynecologists, used to visit the primary health centers to conduct the antenatal camps. They used to give the compassionate advice. I underline the word compassionate because most of the time, most of the doctors in the hospitals, they work for duty. But here, all the doctors who went to the villages or the primary health center, they went to do the service. That's why there was a compassionate attachment to their work. And not only that, they distributed folic acid and iron folic acid, calcium, protein powder to take care of their essential health needs also. This program is conducted along with the Association of the Health and Family Welfare Department of Chikballapura district. Brothers and sisters, this good work across the district brought the MMR below 50% actually, what was the initial one, and the IMR has significantly reduced. We also simultaneously started our school health program in the district. I want to put it on record and thank our Honorable Vice Chancellor of Rajiv Gandhi University of Health Sciences, a good friend of mine, Dr. Ramesh, for going out of the way and granting permission to conduct the school health program in 2017 when he was an interim Vice Chancellor at that time. He called the heads of the department, heads of the medical colleges of Bangalore city, and requested them to post 3 interns and 1 postgraduate from each medical college to this rural health program. Once in a fortnight, for 3 days, about 35 to 50 doctors used to come and examine the students and give the treatment to the required students in all government schools. This is what happened. Nearly 45,000 children were examined and treated. Those who required the secondary or tertiary care treatment, we took the initiation to take them to the appropriate hospitals where they were given free of cost treatment to them. This program became the flagship initiative of Rajiv Gandhi University, and the students demanded us to be the part of this service again and again. The good work obviously comes back to us. As Satish told just now, a couple of students who went to abroad have mentioned in their biodata that we have taken part in this divine program. And in the interview, they were asked only about this program. And they were thrilled and appreciated, and both of them got the job without asking any other questions. This is the effect of the work they have done. These students mailed us and thanked us for giving this opportunity. And not only that, they encouraged their juniors to take part in this program. There were plans for expansion of this program, but COVID struck and everything was standstill. Now, our dear Vice Chancellor, M.K. Ramesh, took up the responsibility, joining hand with us once again, and got the approval from the syndicate for relaunching this project. This time, our target is to screen more than 1.5 lakh children. Dr. Ramesh, being the visionary, wants to expand to other districts also, and he is requesting me to expand to other districts. We are exploring the possibility of that also. Our gratitude to your leadership, Dr. Ramesh. I learned that your name is also there and it is shortlisted in the post of President of NMC. We all sincerely pray for you to occupy that responsible post and take it to the national level and make it as a routine thing in process through NMC. To the students listening to us live, let me remind you that this program is not just an opportunity to practice your skills, but a chance to serve humanity. As future healthcare professionals, your involvement in initiatives like this will shape you into the compassionate and capable doctors who view healthcare not just as a profession, but as a mission. I also seek the divine blessings of Sadhguru Sri Madhusudan Sai for the successful implementation of this program. His guidance and leadership continue to inspire us to work tirelessly for the betterment of the society. May His grace illuminate our path and enable us to overcome challenges with courage and determination. As we embark on this journey together, let us pledge to uphold the highest standards of service and compassion. Let us unite our strengths, share our knowledge, and work towards making this program a model of excellence of our community health care. Once again, I thank the Vice Chancellor, the faculty members, and students for their availability and commitment to this cause. Together, let us ensure that this initiative becomes a beacon of hope for countless rural children and tribute to worthy of centenary birth anniversary of Bhagavan Sri Sathya Sai Baba. Thank you. Jai Saram to all.
Thank you, sir. We will now have the digital launch of the program by the dignitaries on the stage. Thank you, sir. We request Dr. M.K. Ramesh to kindly share a few words. With vast experience as a surgeon and an academician, he was a professor at the Bangalore Medical College. He also served as president of the Postgraduate Medical Education Board of the National Medical Commission and various other academic bodies of the RGHS. Dr. Ramesh, please.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. Seeking the divine blessings of Sadhguru Madhusudan Sai Swamiji, my good friend Raghupati, Chancellor Narsimurthy, Director Shrikant Murthy, and also I recognize the presence of my childhood idol G.R. Vishwanath and Mrs. Raghupati and other devotees and students and staff. In fact, this has been a divine and intimidating experience for me. I didn't know that there will be such a big formal function. In fact, I thought that it's only an informal starting of the program. And I didn't know that even Sadhguru also would visit. But 2 days back, I'm told that you also will be there. I thought you'll come and bless and go, and it will be informal function with some staff, and then I'll go to Raghupati's house, have coffee, and going back. And I didn't even expect that I'm supposed to speak here. Because as I told you, that spiritual experience is less. As my mother and father were Puttaparthi Sai devotees, and once I had visited Puttaparthi and had attended the satsang when I was in, I think, middle school or even the earlier one. And I used to attend bhajans with my mother. After that, apart from going to the temples, my exposure to the spiritual things is, I can say, minimal, very, very minimal. And having said that, as I told you, when I came here, it was very surprising. When I went for the coffee, I met G.R. Vishwanath, I was introduced to him. And when I was studying MBBS in Mysore Medical College, there was a Ranji Trophy match in Oval Grounds, and at that time I had gone and shaked his hands. It was, at that time, it was a divine experience for me, because it was, most of my classmates were G.R. Vishwanath's fans. In fact, we would wait Gavaskar to get out to see that Vishwanath comes onto the crease. That said, this program started in 2017. One day Dr. Raghupati came, along with, Kannan and Fanindra. They broached this idea. I felt it was a good program, because I believe if the health of the children and mother is taken care of, automatically the health of the whole society is taken care of. More than that, what impressed me was to give the exposure to the students of village. So I am brought up in, I was born in a village, I studied in a village, I have the experience. But unfortunately, that's not the case with most of the students. And we say students, medical students, do not go to the villages. We create the schools, colleges in the city, and urban students come, we charge lakhs and crores of donation, and we expect them to go and serve in the villages. It doesn't happen. In fact, when I was in charge vice chancellor, there was an NEP meeting. In that meeting, one dignitary said, we should open 100 medical colleges every year, which are a huge number of medical colleges, so that huge number of doctor population will be there, and they will be pressurized and they will be forced to go to the villages. Then when my turn came, I told, when I joined MBBS also, the same situation was there. The grouse was, nobody will go to the villages. And after so many years, the same situation is there. And even if you open another 5,000 colleges, even after 50 years, the same situation will persist. Same issue, once we had a Chintan we had in Delhi when I was in the NMC. The same issue came up. Then I told, actually, we need to create proper ecosystem in the villages. Or we have to make our students sensitive to the village conditions. What we expect in a village, when somebody gets rank in the PUC and gets into medicine, and his expectation will be settle down in life and lead a comfortable life. What his wife expects, the same comforts. And as I have seen among my classmates and students also, none of them were not against going to the villages. Basic things were lacking. What he needs is some peer companionship, job satisfaction, maybe a good school to his children, and some entertainment to his wife. Unless we provide them whatever we say, the doctors will be reluctant to go to the villages. And another thing is we need to sensitize the students. That's what actually, when we started this program, later on when I took the, feedback, I was surprised to see that most of the students were very, very happy to go there. They would come here, stay 2-3 days, they would mix with the students here, evenings they would play, they'll serve. It was an exhilarating experience for them. I had this in Mangal when I was in Delhi. We started the family adoption program. In this scheme, a student will adopt 5 families. He will visit them periodically. And throughout his career, till he finishes his MBS, he will follow with them. He will develop a relationship with that family. And whatever the care, whatever the counseling, whatever the health facilities are required, he would take care of that family. The idea was more than providing the health care facilities to them. It was to sensitize to the rural conditions, to develop empathy with the family, empathy with the rural people, to develop that care. I mean, that they are in such a bad condition and they should be given the proper care. That type of attitude we wanted to create in the students. With that point in mind, we started that family adoption program. In this also, to initiate this Divine Mother Child program, Chikbalapur is very ideal because only 6 districts, 6 talukas are there, and Sathya Institute is there. Very good backup, devotees and committed volunteers are there. That's how we could make the program successful here. In fact, as Raghupati said, my idea is to expand this to other districts. In fact, I have requested my syndicate members to find philanthropists who could finance in other districts. If anybody comes forward from the university, we are ready to bear 1/3 of the expenditure. If any philanthropist comes, if they are ready to bear 2/3, 1/3 we will bear, and that can be expanded in all the districts. Now the advantage is almost all the districts have medical colleges. And the neighboring districts also have medical colleges. Mobilizing the personnel, the PG students or house surgeons is not a problem. That we will do it. We need good-hearted philanthropists, where more than that, we need committed volunteers in the local region. In fact, in this aspect, I request Sadhguru Swamiji, I think there is a Sai University is in Gulbarga. If they can come forward, the same program we can replicate there. And also other backwards. I think Raghupati also should take interest in this. Because in this part of Karnataka we are doing one, and the neglected part, Kalyan Karnataka also, we should start one. Later on we can expand it to other districts. And I wish that this program is going to be a great success. And within a couple of years, I would like to see it to expand it to all the districts of Karnataka. If it goes well, in the national level also, we can take it from the ambit of the NMC. It can be replicated in other districts of the country also. Having said this, I'm grateful that Raghupati brought me here, and I once again seek the blessings of and offer my pranams to Sadhguru Swamiji and to all of you. Thank you one and all.
Thank you very much for your kind words, sir. We will now extend a token of our appreciation and look forward to your valued partnership and continued support. With sadness in our hearts, we share the passing on of Dr. K.M. Cherian last night, India's preeminent cardiac surgeon. Considered as the father of Indian cardiac surgery, he changed the course of cardiac surgery in India by performing the first coronary artery bypass and also the first heart-lung transplant in the country. A towering figure in the field of medicine, he was a skilled surgeon, healer, teacher, and a mentor who transformed countless lives. In fact, many of our surgeons, both at the Sai Sanjeevani hospitals and here, which include late Dr. Krishna Manohar and Dr. Hiremat, had also trained under Dr. Cherian. Incidentally, he was a chief guest during the Pediatric Heart Valve Repairs Conference that was held here last July. He was touched by the mammoth humanitarian work being done, particularly the free medical education which is being provided, and he had offered a gold medal to be awarded to the best student in cardiac sciences from our medical college. We have a brief video from the occasion.
I came exactly on June 6th, 1975. That was a Friday. Saturday, Sunday, Monday. Monday I had the opportunity to do a open heart. And subsequently, the fourth case which I did was the bypass surgery. I never knew that I was doing the first bypass surgery in the country. And that was a Friday. Monday in the newspaper only I came to know that we did the first bypass surgery in Railway Hospital. You should have a research institute, everything. But because you are all well known, people respect you for what you are doing. So that is why I said, looking at this hall, this is made by God. This is a gold medal, which I am going to present it to respected and revered Sadhguru, to be given for the best outgoing cardiac science student. Cardiology, surgery, anesthesia, perfusion, whatever it is. For the best one.
Drawing inspiration from his values, his passion for excellence, and the drive to make a difference, we request everyone to kindly rise and observe a minute of silence in respect and prayer for Dr. Cherian. Thank you, everyone. I request everyone to kindly resume your seats, please. We now invite Shri B. N. Narsamurthy, Chancellor, Shri Sathya Sai University for Human Excellence, to address us, please.
With pranams at the lotus feet of our dearest Sadhguru, esteemed Dr. N.K. Rameshji, Dr. Srikantimurthy, Dr. Raghupati, brothers and sisters, very dear students, boys and girls. As we were offering our homage to one of the medical geniuses born in our country, I remembered the statement of a Roman statesman, orator, and writer who lived 2000 years ago. And the way he revered the medical profession, the way he paid his homage to doctors and surgeons of those days, he said, "In nothing do men more clearly approach the gods than giving health to their fellow men." That was the statement. That way, is a great ideal for all the medical professionals, not only in our country, anywhere in the world. The genius coupled with compassion in the heart is something which will make the medical profession divine. In fact, as Dr. Rameshji, when he said, when you take care of the health of the children and the mothers, you take care of the society. This is what exactly Agatha Christie, one of the most famous English novelists of our times, said. This is exactly what she said. Rameshji would be very happy to know that. She said, you take care of the kids and you take care of the society. Very simple sentence. She had a reason to say that. Another very famous statement from Agatha Christie is related to this. She said, one of the luckiest things that can happen to you in your life is to have a happy childhood. You have to remember, she lived with us in the last century. She passed away in 1976. She was born in a rich family, but she never had a happy childhood. That is the reason why she said. And our children, our students should value this. All of you have got a happy childhood on a platter because of the grace and blessings of Sadhguru Sri Madhusudan Sai, and especially in a country like India, where poverty is still a problem. Poverty not because the people lack money, because when I compare the kind of villages we saw when we were children, every village was full of thatched huts. And today you go to any village, you don't find a thatched hut. There are good houses. And both the state government and the central government are taking care of the basic needs of everyone. But in spite of this, the parents are not happy. Naturally, children are not happy. Children don't get happy childhood. What is it? This is spiritual poverty. Spiritual poverty which leads the poor people into bad habits, where they squander all the money that they earn, which would be definitely be enough for leading a good life. And then the women suffer, the children suffer. Therefore, in total, this particular program, initiated by the Rajiv Gandhi University, along with our university, is going to be a game changer, because we also have a spiritual touch in this to make a child happy, because happy children means strong society. Happy children means happy societies. You have to give not only the basic material needs, that is one side. Other side, the inputs required on the emotional side, very, very important for children. And then on the intellectual side, and finally on the spiritual side, when you give proper inputs to the child in any society, all these four kind of inputs which are required, physical inputs in the form of basic material, food, nutrition, healthcare, and things like that, and good education, intellectual and emotional development, plus the spiritual touch, definitely is going to work a wonder in transforming so-called poor country, so-called rich country with poor people, into a really a very, very happy and rich and prosperous country. With these words, I conclude and pray to Sadhguru for his benedictory discourse. Thank you very much. Sai Ram to you.
It is said in our scriptures, Dharmartha Kama Mokshartham Arogyam Moolam Uttamam. To attain the four goals of life of Dharma, Artha, Kama and Moksha, the most important thing that one needs is Arogya, good health. That is why it is said health is wealth. Because if you have health, you can achieve anything. To ensure that a nation is healthy, you must ensure that the mothers and children of the nation are healthy. And to this end, this program, Divine Mother and Child Health Program, which was actually conceptualized in Raipur. And Dr. C. Srinivas then was talking about primary health and how do we reach out to a lot of people, especially women in the tribal and remote areas. That's how this program started, and it has spread to so many places and countries. And now in Karnataka, with Chikbalapur district, with the support and patronization of Dr. Ramesh through Rajiv Gandhi University of Health Sciences, I hope that not just 1.5 lakh children, but all the children in Karnataka will be screened and looked after in the coming years with this association and collaboration. When we think who is the most important person in the society, to me the answer is a child, because the child is the future of the society. And what kind of future we create depends on what we do with our children today. Similarly, if somebody asks who is the most contributing citizen of the country, I would say it's a mother, because she contributes a child to the country. There can't be a greater contribution. So mother and children are the most important people who have to be looked after, but unfortunately, they are the only ones who are not looked after very well in the society, especially in a poor rural society. I'm glad that this program is being restarted. It had its own impact, as we saw in the presentations. And by stopping it, we actually did a disservice. Now we are restarting it and hoping to do it even better with our hospital being around, that can even solve the problems to the extent of tertiary care if needed, which wasn't there in 2017. So that is the additional advantage in Chikbalapur, as was observed by Dr. Ramesh. I also want to thank and appreciate the efforts of our Department of Mother and Child, Community Health Department, who have worked very hard to reach out to the remotest places, not minding the difficulties and challenges. And they worked hand in hand with ASHA workers, with Anganwadi workers, with school teachers, with parents, to ensure that nutrition and healthcare is delivered at their doorsteps. SciSure, which is a multi-nutrition program for children, infants, to school-going children, adolescent girls, pregnant women, to lactating mothers, to toddlers. It's a life cycle approach that we have taken, and that is an integral part of ensuring a good health for the entire district as well as the country. I was told, a happy news, Dr. Ramesh, that in Bagepalli Taluk, there hasn't been even one maternal death in the last year, which was one of the worst taluks in Chikbalapur district. And I think somewhere we can attribute the reason to this is because of the high-end neonatal care facility which is here now in Sarla Memorial Hospital, and all the complicated cases are also taken up and looked after. We have kept children for 30, 40 preterm babies of 30 days, 40 days preterm, and nursed them to health and life. This is a contribution this hospital has made. And I'm sure as we identify more of these issues in the society, the logical end to the whole thing is to give them the tertiary intervention when they require it. What is the point in identifying and leaving them in a high and dry without providing them the care? So the hospital and the medical school locally available is a great boon for making sure that this program is totally impactful and effective, not just identification, treatment, diagnosis, but at the end, if there is an intervention required, it is done free of charge in this hospital, so also with the local hospitals that we are working with. In the coming year, when the new facility is going to be ready, this entire facility, the previous Sarla Memorial Hospital, will be completely turned into a mother and child hospital. So that would further serve the cause of better health for the women and children of this district and the surrounding districts. I am very grateful to the management, to the government of Karnataka, to Dr. Ramesh in specific for taking it upon himself. His tenure is coming to an end, that I know. And so he made it a point that he got this program done. So I'm very grateful to you. And I hope that in coming times you will achieve greater heights. And this program, which is a visionary program, can be extended to every child, every mother in our country, and even beyond if it is in our capacity. For the medical students, nursing students and others, these are examples of public service. They have had an illustrious career, but they have decided to stay back in the country and serve. When I go around the world, I see a lot of Indian doctors who are doing very well. And I keep reminding them that you have an obligation towards your country and you must contribute to the welfare of the people back home while you also contribute to the people around the world. To our students, medical students and nursing students, please take these as examples. Just now we saw the video on Dr. Cherian. He was the first to do a heart transplant in India, as he was mentioning in his own speech. He could have also been there, done that, and for those times he was a very renowned cardiac surgeon. But he came back, set up his own hospital, worked with many hospitals, and taught so many people, trained so many people, which is why so many people are saved in our country, because he shared his knowledge with others. And that is something you must also do when you grow up, when you have it in your capacity. Please ensure that not only you go and treat patients, but you also train the next generation, which will help to create better quality doctors, nurses, paramedics for the country and beyond. India is a land of diversity. Every state is different, every population is different. There is a lot more work that needs to be done still for our people, especially in remote tribal areas. And as we open more Sai Swasthya centers, which are diagnostic centers, wellness centers across the country, we will be able to reach out to many more people in such corners of our country. But we need the right kind of professionals who have the competence as well as compassion in them, as Dr. Raghupati mentioned. And we are really pinning all our hopes on all of you here, as well as the students of various medical colleges who are going to be participants in this program across the Chikbalapur district. And I have taken note of Dr. Ramesh's request. We have already started the nutrition program across all the government schools in Karnataka, and over 55 lakh children from class 1 to 10th are served Saisho Ragi malt across the government schools. Our idea would be to work again with the government, with Rajiv Gandhi University and the syndicate, to ensure that all these children whom we are anyway reaching out in terms of nutritional intervention, we also can take care of their health care. We can screen them, if not too often, at least once in a year. If every child can be looked into and screened, I think that would be a great achievement, because you would have built a better, healthier future for this state and for beyond. I am sure our children would happily participate, so also the children of all other universities. And I place the collective gratitude, not on my personal behalf alone, but on behalf of hundreds and thousands of mothers and children who are going to benefit from this program. We cherish this partnership, and partnership for change is one of the sustainable development goals, and that is the only way we can solve the problems of the world, when we sync our differences and collaborate, combine our strengths, and co-create a better country for all of us with our collective efforts. So thanking everybody who is a part of this initiative, and I know miles to go before we sleep. There is a long way ahead for a country like ours, which is so large. A lot of work needs to be done. But I hope in his future capacities, Dr. Ramesh will facilitate many such revolutionary, visionary programs across the country, especially at primary healthcare level, at interventional levels also, which will ensure that nobody falls sick, and if they are falling sick, they have possibilities of seeking a remedy at almost no charge in one of the hospitals. So we are looking forward to working continuously with the government, with the organizations like Rajiv Gandhi University and many like-minded organizations and the society at large. Ours is the 3S partnership model of Samaja, Sarkara and Samstha, through which we should be able to achieve all this. Before I conclude, may I again offer our respects to Dr. K.M. Cherian, who had great vision. He had come here for a long time. He discussed with me how he wanted to develop indigenous valves, made in India valves, and better the previous valves, and do so much more, including the pericardium of bovine as well as other ways. He wanted to create local valves which are not synthetic, so that it has better outcome, less maintenance. He had many dreams like this. He wanted to set up a med city too. And I hope that in our own lifetime we would be able to fulfill some of his desires to create these devices as well as valves and other things that he dreamt of. For now, as a humble tribute to his memory, may I offer to name our heart valve bank, which is coming up shortly, in the name of Dr. K.M. Cherian as Dr. K.M. Cherian Heart Valve Bank of our institute. I once again thank everyone who is a part of it, the director, the vice chancellor, the chancellor, Dr. Satish Babu, the program in charges, Dr. Fanindra, Dr. Annara, and everybody who is a part of this program. A lot of blessings and best wishes for what you have embarked upon. I'm sure this will definitely be impactful and make a difference to the health profile of the children and mothers in our country, in our state, in our district. And I would like to see a day when there is no MMR, there is no IMR, at least which is avoidable, should not happen. That extent we must work and ensure. And wishing once again everybody a happy Republic Day, and ensuring that we all work together to create a better country for each other. Thanking everybody, I conclude.
Offering our gratitude to Sadhguru, we once again thank Dr. Ramesh for his presence here today, and most importantly, this partnership, which will surely have a lasting impact not just on the beneficiary mothers and children, but on every doctor and healthcare worker. Thank you all for your patience. We will conclude the program with Mangal Arti.
ओम जय जगदीश हरे स्वामी सत्य साई हरे भक्त जना संरक्षक भक्त जना संरक्षक भक्ति महेश्वर ओम जय जगदीश हरे शशिवदना श्रीकरा सर्वा प्राणपते स्वामी सर्वा प्राणपते आश्रित कल्पलतिका आश्रित कल्पलतिका आवद्बान्धवा ओम जय जगदीश हरे मात पिता गुरुदैवमु मरियन्तयु नीवे स्वामी मरियन्तयु नीवे नाद ब्रह्म जगन्नाथा नाद ब्रह्म जगन्नाथा नागेन्द्र शयना ओम जय जगदीश हरे ओंकार रूप ओजस्विनो साई महादेवा सद्गुरु साई महादेवा मंगल हारति अंदुको मंगल हारति अंदुको मंदर गिरिधारी ओम जय जगदीश हरे नारायण नारायण ओम सत्य नारायण 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 ओम नारायण नारायण ओम सत्य नारायण नारायण ओम सत्य नारायण नारायण ओम जय सद्गुरुदेवा नारायण नारायण ओम सत्य नारायण 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 ओम नारायण नारायण ओम सत्य नारायण नारायण ओम सत्य नारायण 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 ॐ जय सद्गुरुदेवा ॐ शान्ति 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 समस्तलोका सुखिनो भवन्तु समस्तलोका सुखिनो भवन्तु समस्तलोका सुखिनो भवन्तु ॐ शान्ति 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 जय बोलो भगवान श्री सत्य साई बाबा जी की जय जय बोलो सद्गुरु श्री मधुसूदन साई जी की जय